Allergy. Triamcinolone. Article. Drug class, corticosteroid. Indication: allergic disorders, skin conditions, ulcerative colitis, arthritis, lupus, psoriasis, or breathing disorder. Side effect: sleep problems, mood changes, changes in body fat distribution, slow wound healing, bruising, weight gain. Alacort, hydrocortisone, topical. Drug class, corticosteroid. Alacort should be applied to the affected area, otherwise it could lead to skin damage and an increased risk of infection. Indication: inflammation and itch caused by a variety of skin conditions. Side effect: insomnia, irritability, acne, thin skin, easy bruising, slow wound healing. Rayos, deltazone, prednisolone. Drug class, corticosteroid, a type of anti-inflammatory drug. Indication: inflammatory conditions, immunosuppressant. Used to treat wide range of conditions including lupus, arthritis, psoriasis, skin disease, and breathing disorder. Side effect: insomnia, mood change, slow wound healing, weight gain, acne, thin skin, easy bruising. Flopred, prednisolone. Drug class, corticosteroid. Indication: inflammatory conditions, immunosuppressant. Hence, it is used to treat a wide range of conditions including lupus, arthritis, psoriasis, breathing disorder. Side effect: insomnia, mood changes, weight gain, acne, thin skin, easy bruising, slow wound healing. Lodricin, clotrimazole, betamethasone. Drug class, antifungal, steroid drug. Steroid is used to reduce itch, swelling, and redness of skin. Indication: athletics, foot, jog itch, ringworm. Side effect: skin dryness or rash, swelling, increased risk of new infections, numbness, tingling, or stinging. Nizor topical, ketoconazole. Drug class, antifungal drug. Indication: pityriasis, to control dandruff. Side effect: discoloration to the hair, pimple-like bump on the scalp, dry hair and scalp, abnormal hair texture. Flonase nasal spray, fluticasone, propionate, anti-allergy. Nasal congestions, runny nose, itch, or water eye. Fluticasone is an anti-inflammatory drug that reduces inflammation and pain linked to allergies. Side effect: minor nose bleed or burning, headache, back pain, white patches inside nose, sinus pain, sore throat, fever. And this is a medication for asthma. Singular, Montelukast, leukotriene inhibitor. Prevent asthma side effect. No indication. Prevent asthma attacks, symptoms of year-round allergies. Leukotrienes are compounds in the body that promotes the inflammatory process. Side effect: stomach pain, diarrhea, flu-like symptoms, ear aches, trouble hearing, headache. Proair Ventolin Proventil, albuterol. It's an inhaler. Drug class, beta-2 agonist. Air flow to lung. Beta-2 receptors are found on lungs. Asthma indication, asthma, COPD, prevent bronchospasm, side effect, tachycardia, palpitations, anxiety, tremor. Combivent Respimat, albuterol, ipratropium, bronchodilators, smooth muscle of airway. Indication, prevent bronchospasm in COPD. Albuterol works as a beta-2 agonist. Ipratropium is an anticholinergic medicine. Both are bronchodilators. Side effect, cold-like symptoms, headaches, trouble breathing, muscle cramp. Vesicare, solifenacin, drug class, antimuscarinic drug, inhibits the effects of acetylcholine at muscarinic receptors. Indication, overactive bladder, reducing urinary frequency, urgency, and urge incontinence. Inconfidence, dry mouth, tachycardia, blurred vision, constipation. Spirava, tiotropium, drug class, anticholinergic. Spiriva is a bronchodilator that relaxes lung muscle to increase airflow to the lung. Indication, prevent bronchospasm in COPD, prevent asthma attack. Side effect, dry mouth, blurred vision, constipation, cold-like symptoms. These are supplements and other drugs. Viosol, ferrous sulfate, drug class, iron supplement. Indication, iron deficiency anemia. Ferrous sulfate is a form of iron. In the body, iron becomes part of hemoglobin in red blood cells, which plays a role in transporting oxygen around body. Side effect, constipation, upset stomach, dark black colored stools, temporary straining of teeth. Niacin, form of vitamin B3. High blood cholesterol, indication, high blood cholesterol, high blood triglycerides. Its use is recommended along with changes to diet and exercise. Side effect, fatigue, dizziness, numbness or tingly sensations, itchy, dry skin, insomnia. Sensipar, Zinacalcet, drug class, cosimimetic. Indication, hyperparathyroidism due to kidney failure. High blood calcium due to parathyroid carcinoma. Side effect, nausea, vomiting, headache, fatigue, low blood pressure, hypotension, tingling in arms, feet, hands. Renvela, sevelamer, drug class, phosphate binder. Revela is used in patients with chronic kidney disease who cannot control phosphate level. Indication, sevelamer prevents low calcium levels by elevating phosphorus levels in the body. Side effect, nausea, vomiting, upset stomach, diarrhea, constipation, fatigue, itch or joint pain. Betacep chloroprep, chlorhexidine. Drug class, disinfectant, antiseptic. Indication, skin disinfection before surgery, sterilize surgical equipment, wound cleaning procedures, prevent dental plaque. Side effect, tooth discoloration, skin irritation, allergic reaction, ototoxic can cause deafness. X-lax, Senalax, Sena. Drug class, laxative. Relieve and prevent constipation. Indication, Sena is used to treat constipation and empty the large intestine before surgery. It is weaker laxative than bisacodyl or castor oil. Side effect, abdominal cramp, diarrhea, nausea, vomiting. Robitussin, dextromethorphan, guaifenesin. Dextromethorphan, guaifenesin. Drug class, cough and cold medicine. Dextromethorphan is a cough suppressant. Guaifenesin is an expectorant, promotes muscle production removal. Indication, cough and chest congestion caused by common cold allergies. Side effect, dizziness, drowsiness, insomnia, diarrhea, feeling nervous or anxious. Galenia, fingolimod, immunodulator. Multiple sclerosis shuttles white blood cells, known as lymphocytes, into lymph nodes so that it reduces the body's attack in this autoimmune disease. Side effect, flu-like symptoms, headaches, diarrhea, abdominal pain. Sterala, ustekinumab, immunosuppressant. Ustekinumab works by reducing inflammation in the body. Indication, plaque, psoriasis, psoriatic arthritis, Crohn's disease. Side effect, flu-like symptoms, itch, vaginal itch or discharge, pain or burning when urinating. Sand immune neurocyclosporin. Drug class, immunosuppressant. Cyclosporin weakens the immune system to the body doesn't overreact and cause damage. Indication, prevent organ transplant rejection, severe psoriasis, RH arthritis. Side effect, increased hair growth, hypertension, kidney, liver toxicity, gum enlargement. Cardiovascular drug, microzide, aquazide, hydrochlorothiazide, HCTZ. Drug class, thiazide diuretic. Diuretics are water pills, drug that increase urine flow, also for high blood pressure and swelling. Indication, hypertension, fluid retention, congestive heart failure. Diuretic drugs promote water and electrolytes loss. Side effect, hyponatremia, hypokalemia, hypotense, increase of gout. Pernivio, Querbelis, lisinopril. Drug class, ACE inhibitor. ACE inhibitors are angiotensin converting enzyme blocker. Treatment for high blood pressure and heart failure. Indication: hypertension, chronic heart failure, ischemic heart disease. ACE inhibitors always ends in the suffix "prio". Side effect: persistent dry cough, hypertension, elevated potassium level, increased risk of kidney failure. ASEAN: perindopril. Drug class: ACE inhibitor. Prio. Indication: hypertension, chronic heart failure, ischemic heart disease. Side effect: persistent dry cough, hypertension, elevated potassium levels, increased risk of kidney failure. Altase, ramipril. Drug class: ACE inhibitor. Suffix prio. Treatment for high blood pressure and heart failure. Indication: hypertension, chronic heart failure, ischemic heart disease. Side effect: persistent dry cough, hypotension, elevated potassium level, increased risk of kidney failure. Vasotec, Epand, enalapril. Drug class: ACE inhibitor. Suffix prio. Indication: hypertension, chronic heart failure, ischemic heart disease. Side effect: persistent dry cough, hypertension, elevated potassium level, increased risk of kidney failure. Hyzer, hydrochlorothiazide, losartan. Drug class: diuretic angiotensin II blocker, also called ARBs. Diuretic cause electrolyte and water removal from the body. Angiotensin II blockers are used to reduce blood pressure. Indication: hypertension. Side effect: dizziness, cold-like symptoms, high level of uric acid, hyponatremia. Benicar or Benicar, hydrochlorothiazide, olmesartan. Drug class: diuretic angiotensin II blocker, or it's also called ARBs. Diuretic cause electrolytes and water removal from the body. Angiotensin II blockers are used to reduce blood pressure. Indication: hypertension. Side effect: dizziness, cold-like symptoms, high level of uric acid, hyponatremia, low sodium levels. Avalide, hydrochlorothiazide, irbesartan. Drug class: diuretic angiotensin II blocker, also called ARBs. Diuretics cause electrolyte and water removal from the body. Angiotensin II blockers are used to reduce blood pressure. Indication: hypertension. Side effect: dizziness, cold-like symptoms, high levels of uric acid, hyponatremia. Coreg, carvedilol. Drug class: beta blocker. Suffix LOL, LOL. It's for high blood pressure, irregular heartbeat. Indication: angina, hypertension. Side effect: dizziness, fatigue, shortness of breath, depression, vivid nightmares. Zebeda, bisoprolol. Drug class: beta blocker. Suffix LOL. Beta blocker is for high blood pressure and irregular heartbeat. Indication: angina and hypertension, dizziness, fatigue, shortness of breath, depression, vivid nightmares. Low pressure, metoprolol. Drug class, beta blocker. Suffix, LOL. Beta blockers are high blood pressure and irregular heartbeat. Indication, angina and hypertension. Side effect, dizziness, fatigue, shortness of breath, depression, vivid nightmares. Tenormin, atenolol, drug class, beta blocker. Reduces blood pressure. It's also for high blood pressure and irregular heartbeat. Indication, angina and hypertension. Angina is for chest pain. Side effect, dizziness, shortness of breath, increased risk of type 2 diabetes, and fatigue. Norvasc, Keterzia, amlodipine. Drug class, calcium channel blocker. It's for lower blood pressure. Indication, hypertension, control symptoms in stable angina. It is only for use in adults and children who are at least 6 years old. Side effect, ankle swelling, flushing, headache, and palpitation. Lasix, furosemide. Drug class, loop diuretic. Diuretics are water pills. Loop diuretics treats hypertension, edema, often due to heart failure or chronic kidney disease, and swelling from various diseases. Indication, acute pulmonary edema. It's a life-threatening cough of blood, chronic heart failure, other states of fluid buildup. Diuretics cause electrolytes and water removal from the body. Side effect, dehydration, hypotension, low electrolytes state, tinnitus or tinnitus. Adactone, spironolactone. Drug class, potassium-sparing diuretic. Diuretics cause electrolyte and water removal from the body, high blood pressure, and heart failure. Indication, fluid retention, chronic heart failure, and hypertension. Side effect, dehydration, hypotension, gynecomastia, high potassium level, dizziness, dry mouth, and fatigue. Duranium, triamterene. Drug class, potassium-sparing diuretic. Medicines that increase diuresis, urination without the loss of potassium. Potassium-sparing diuretic is for high blood pressure and heart failure. Indication, fluid retention, chronic heart failure, cirrhosis of the liver. It is a chronic liver damage. Diuretics cause electrolytes and water removal from the body. Side effect, dehydration, high potassium level, dizziness, dry mouth, fatigue, and hypotension. Nitrostat, sublingual nitroglycerin. Drug class, nitrate. Nitrate dilate blood vessel to improve blood flow. Indication, angina. Angina is a pain or discomfort from the chest, arising from the heart not receiving enough blood. Side effect: flushing, pale skin, feeling weak or dizzy, and headache. Imdur, isosorbide mononitrate. Drug class: nitrate. Nitrate dilate blood vessel, making it easier for blood to flow. Indication: prevent angina attack, esophageal spasm, it's called 경련. And side effect: flushing, headache, lightheadedness, hypotension. GI medications. GI medications are for constipation. Zantac, ranitidine. Drug class: H2 antagonist. H2 antagonists reduce gastric acid production in the stomach. Indication: dyspepsia. Dyspepsias or discomfort in upper abdomen. Dyspepsia and GERD, peptic ulcer disease, Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is a rare digestive disorder result in too much gastric acid. Side effect: dizziness, headache, intestinal upset, constipation, or diarrhea. Pepsid famotidine. Drug class: H2 antagonist. H2 antagonists reduce gastric acid production in stomach. Indication: dyspepsia, GERD, peptic ulcer disease, Zollinger-Ellison syndrome. H2 antagonist reduces gastric and production in the stomach. Side effect: dizziness, headache, intestinal upset, constipation, or diarrhea. Protonics, pantoprazole. It's a drug class is proton pump inhibitor, also called PPI. It's a stomach medicine, acid reflux users. Indication: peptic ulcer disease, dyspepsia, GERD, Helicobacter pylori infection. PPIs inhibit the pump in gastric parietal cell, reducing acid production. Side effect: nausea, diarrhea, headache, low magnesium level in long-term use. Acipex, rabeprazole, proton pump inhibitor, also called PPI. PPIs inhibits the pump in gastric parietal cells, reducing acid production. Indication: peptic ulcer disease, dyspepsia, GERD, Helicobacter pylori infection. Side effect: nausea, diarrhea, headache, low magnesium level with long-term use. Nexium, esomeprazole. Drug class: proton pump inhibitor. PPIs inhibit the pump in gastric parietal cells, reducing acid production. Indication: peptic ulcer disease, dyspepsia, GERD, Helicobacter pylori infection. Side effect: nausea, diarrhea, headache, low magnesium level in long-term use. Prevacid, lansoprazole. Drug class: proton pump inhibitor. PPIs inhibit the pump in gastric parietal cells, reducing acid production. Indication: peptic ulcer disease, dyspepsia, 소화불량, and GERD, 식도염, Helicobacter pylori infection, 헬리코박터리 감염증. Side effect: nausea, diarrhea, headache, low magnesium level with long-term use. Prilosec, omeprazole, drug class, proton pump inhibitor. Peptic ulcer disease, dyspepsia, and GERD, Helicobacter pylori infection. Side effect: nausea, diarrhea, headache, low magnesium level, long term. Tusionex pankinetic, chlorpheniramine hydrocodone, chlorpheniramine hydrocodone, drug class, antihistamine and narcotic. Indication: runny nose, sneezing, itching, watery eyes, or cough caused by colds, flu, or allergy. Hydrocodone is a narcotic and so it has abuse potential. Side effect: trouble breathing, drowsiness, confusion, nausea, vomiting, and reduced urination. Zofran, ondansetron, drug class, 5-HT3 antagonist. 5-HT3 antagonists are prevention and treatment of nausea, vomiting, particularly caused by chemotherapy, radiation therapy, postoperative. 5-HT3 is an abbreviation for serotonin, also written as 5-hydroxytryptamine. Indication: prevent nausea and vomiting due to cancer, chemotherapy, radiation, or surgery. Antiemetic drugs are used to treat nausea and vomiting. Side effect: headache, diarrhea, sleepiness, QT prolongation. Kitrio sancuso, granisetron. Kitrio sancuso and granisetrione. Drug class: 5-HT3 antagonists. Antiemetic drugs are used to treat nausea and vomiting. Indication: prevent nausea and vomiting due to cancer, chemotherapy, radiation, or surgery. Side effect: headache, diarrhea, sleepiness, QT prolongation. Constellus, lactulose. Drug class: laxative. Laxative, it begins working after 8 to 12 hours and may take up to 2 days to completely relieve constipation. Indication: chronic constipation, hepatic encephalopathy. Side effect: abdominal bloating, cramps, electrolyte loss, flatulence, and nausea, vomiting. Bentyl diclomine, drug class, antispasmodic drug. Antispasmodic drugs reduce spasm, 경련, or contraction in intestine, reduce abdominal pain and discomfort. Indication: bowel or stomach spasms, irritable bowel syndrome. Diclomine blocks the action of acetylcholine on receptors found on smooth muscle. Side effect: dry mouth, blurred vision, constipation, difficulty urinating. Pain medication: Tylenol, acetaminophen. It's also called APAP. Drug class, analgesic. Analgesic is for mild pain. Indication, pain reliever, analgesic, and fever reducer, antipyrectic. Tylenol does not reduce inflammation and so it is not classed as NSAID, NSAID. Indication, nausea, stomach pain, loss of appetite, headache. Vicodin. APAP hydrocodone. APAP is also called acetaminophen. Drug class, analgesic. Analgesics are acting to relieve pain. Indication, moderate to severe pain. APAP, acetaminophen, hydrocodone, opioid analgesic. Side effect, constipation, dry mouth, blurred vision, upset stomach. Percocet, acetaminophen, APAP, oxycodone. Drug class, analgesic and opioid. Due to oxycodone, an opioid, there is a risk of addiction and abuse potential with this medicine. Indication, moderate to severe pain. Side effect, dizziness, drowsiness, fatigue, constipation, nausea, vomiting, blurred vision, red eyes, dry mouth. Methadone. Drug class, opioid analgesic. Indication, severe pain, opioid addiction. Close monitoring is required because strong opioids can lead to serious addiction problems. Side effect, respiratory depression, sweating, sleepiness, abnormal heart rhythm. Ultram, tramadol. Drug class, opiate narcotic. Indication, moderate to severe pain. There is also an extended release form of this drug for round-the-clock pain relief. Side effect, constipation, headache, fatigue, stomach pain. Buprenorphine, naloxone, Suboxone. Drug class, narcotic opioid blocker. Indication, narcotic opioid addiction, moderate to severe pain. Naloxone is also used as an antidote 해독제 to opioid toxicity. Side effect, dizziness, blurred vision, tongue pain, mouth numbness, pounding heartbeats, insomnia, difficulty concentrating. Duragesic skin patch. Fentanyl. Drug class, opioid narcotic. Indication, moderate to severe chronic pain in opioid-tolerant patients. Fentanyl patches are very strong and are typically only used when other analgesics have failed. Side effect, constipation, respiratory depression, drowsiness, dizziness, headache, insomnia. Advil, ibuprofen, NSAID. NSAIDs are non-steroidal anti-inflammatory drugs which work by inhibiting COX enzymes. Indication, mild to moderate pain, pain related to inflammation. Side effect, GI toxicity, increased bleeding risk, increased risk of CV event, increased risk of renal damage. Celebrex, celecoxib, NSAID. NSAIDs are non-steroid and anti-inflammatory drugs which works by inhibiting COX enzymes. Indication, mid to moderate pain, pain-related inflammation. Side effect: GI toxicity, increased bleeding risk, increased risk of CV events, increased risk of renal damage. Cataflam, diclofenac, drug class NSAID. Mild to moderate pain, pain related to inflammation. Side effect: GI toxicity, increased bleeding risk, increased risk of CV event, increased risk of renal damage. Mobic meloxicam, drug class NSAID. Indication: mild to moderate pain, pain related to inflammation. Side effect: GI toxicity, increased bleeding risk, increased risk of CV events, increased risk of renal damage. Aleve, naproxen, drug class NSAID. NSAIDs are non-steroid anti-inflammatory drugs which works by inhibiting COX enzymes. Indication: mild to moderate pain, pain related to inflammation. Side effect: GI toxicity, increased bleeding risk, increased risk of CV event, increased risk of renal damage. Relafan, nabumetan, drug class NSAID. Indication: mild to moderate pain, pain related to inflammation. Side effect: GI toxicity, increased bleeding risk, increased risk of CV event, increased risk of renal damage. Bayer Ecotrine Bufferin, aspirin, drug class antipyretic and analgesic. Analgesic is pain reliever, antipyretic is fever reducer. Antiplatelet effects at low dose can stop blood clots from forming. Indication: treat ACS. ACA is acute coronary syndrome and stroke. It reduces blood flow to heart. Prevention of CV disease and mild to moderate pain and fever. Side effect: increased risk of bleeding, tinnitus, 이명, at high dose, bronchospasm, and GI ulceration and hemorrhage. Nighttime, acetaminophen, diphenhydramine, drug class analgesic, antihistamine. Indication: treat headache, runny nose, sneezing, watery eyes, and pain or fever caused by allergies, the common cold, or the flu. Side effect: constipation, dry eyes, blurred vision, dry mouth, dizziness, drowsiness, mild skin rash. Fioricet, acetaminophen, butalbital, caffeine. Analgesic, barbiturate. Drug class: acetaminophen is an analgesic. Barbiturate is a barbiturate that relaxes muscle. So drug class is analgesic and barbiturate. Indication: tension headache caused by muscle contractions. Side effect: drowsiness, dizziness, feeling anxious or restless, drunk type of feeling, insomnia is sleep problems. Feridium, phenazopyridine, drug class pain reliever. Indication: analgesic, 진통제, that reduces pain and discomfort caused by urinary tract infections or injury. It treats symptoms, not an infection itself. Side effect: orange discolored urine, headache, dizziness, upset stomach. Lidoderm, lidocaine topical, drug class, local anesthetic. Local anesthetic creates absence of pain in a specific location of the body without loss of consciousness, opposed to general anesthetic. Indication: to induce local anesthesia to relieve post-shingles pain, shingles or 대상포진, and reduce discomfort by skin irritation or burn. Side effect: local irritation or swelling, numbness, uneven heartbeat is very rare side effect, and seizures are also rare side effect. Xanaflex, Tizanidone, Xanaflex, Tizanidone, drug class, muscle relaxant. Indication: spasticity associated with conditions such as multiple sclerosis and spinal cord injuries. Ciprofloxacin is contraindicated for use with tizanidine. Contraindicated is 금기사항. Side effect: drowsiness, dizziness, weakness, dry mouth, feeling nervous, and elevated liver enzyme, flu-like symptoms. Leoricel, baclofen, drug class, muscle relaxant. Indication: relax muscles, treat spasm in patient with multiple sclerosis. This treatment should not be withdrawn suddenly. Side effect: feeling dizziness, sleepy or weak, trouble sleeping, upset stomach, vomiting, and headache. Carbachol robaxin, methocarbamol, drug class, muscle relaxant. Indication: skeletal muscle conditions that require muscle relaxation, such as injury or disease like tetanus. It blocks nerve impulses that are sent to your brain. Side effect: headache, dizziness, drowsiness, confusion, memory problems, blurred or double vision, sleep problems. Reflex elatriptan, drug class, anti-migraine drug. Migraine, cluster headaches. Triptans are serotonin receptor agonists that the 5-HT1B and 5-HT1D receptors. Side effect: dry mouth, upset stomach, increased risk of CV event, neck pain or stiffness, numbness or tingling sensation. Imitrex, sumatriptan, drug class, anti-migraine drug. Indication: migration, cluster headache. Triptans are serotonin receptor agonists at the 5-HT1B and 5-HT1D receptors. Side effect: green blood, increased risk of CV event, neck pain, stiffness, numbness, or tingling sensation. Zomig, zomitriptan, drug class, anti-migraine drug. Triptans are serotonin receptor antagonists at the 5-HT1B and 5-H1D receptors. Indication: migraine and cluster headache. Side effect: dry mouth, upset stomach, increased risk of CV event, neck pain or stiffness, numbness or tingling sensation.